Today we've come down by bus from Wyong because following the petitions, it was to be debated and we want to be part of that debate at the gallery.
I'm very upset that we have to be here actually doing it, and I would like to recognise the people in the gallery today from the Wyong and the Central Coast, nurses, hospital workers and community workers who are here to show their dismay at the government's proposed privatisation of our local community Wyong hospital.
I feel so strongly about this. This is my patients that I'm talking about, and I am so concerned about what's going to happen with this.
Nobody is going to spend $200 million and run a hospital for 40 years and not make any money. And the government says to the community, oh, trust us, it's not going to cost you any more, it's not going to cost any more. Well, it is.
What I'm getting out of this is they're going to want to do what they want to do. It's not a democracy that we're living in.
The people of Wyong will not be pushed around, and when we get challenged, we stand up and we fight back.
What do we do when we're under attack?
But the important thing about this issue is we're asking the questions that you are asking, and you deserve answers.
The first thing for me to note, Speaker, is the Minister isn't here, and that's deplorable. Yeah. It's deplorable. It's deplorable because of the people that are here to listen to what the Speaker could have said about this matter.
The Minister stands up here and says, oh no, it's following the successful model of the Northern Beaches Hospital. The successful model of the Northern Beaches Hospital. Well, guess what? Guess what? It's never had a patient. It doesn't open for another 2 years. The Auditor General should independently evaluate this, looking at what it would cost and the public benefit if the government did it, just did the upgrade and kept the hospital for 40 years, and if the private sector does it.
The petition asks this House to reject any move towards privatisation of the grounds or services currently delivered at Wyong Public Hospital. And I must say to the House and to the people in the gallery, I proudly support the sentiment of the petition.
We also know with Northern Beaches Hospital there is segregation. We know that if you need intensive care, there will be an intensive care unit for public patients and there will be an intensive care unit for private patients. In my community, I want one hospital that serves every single constituent, whether you're a public patient or you're a private patient, and that's what my community deserves.
Julian Skinner, why don't you answer our questions? Why don't you come up to Wyong and address us? Address us as a community, or give the community the choice of determining whether they want a private-public partnership or not.